Hey guys, welcome to Man Medicine. This is the mobile edition. We're still going to talk about optimizing health, and we're still going to talk about staying out of the collapsing healthcare system. But in this special edition, we're going to do it from my truck. So I'm actually on the way to the emergency room right now to work some shifts. I work in an emergency room that's about, well, in the summertime, it's about 2.5 hours away. In the wintertime, these roads can get a little bit hairy, and it can take me up to 4 hours to get to work sometimes. So that's where I'm headed. So today I want to talk about something that might get me in a little bit of trouble, might not, I don't know. It's this whole idea of that there's no such thing as alternative medicine. There's no such thing as naturopathic medicine. There's no such thing as functional medicine. There's just medicine. All right, and that may come as a bit of a shock to you, and it might piss off a few of you that consider yourselves practitioners in those fields, but hear me out. In the world of medicine, I think of things along a spectrum in terms of efficacy. So let's just say on the right side of the spectrum are things that we know work. They're proven clinically, they're proven with objective, well-done scientific studies, ideally, randomized, controlled, placebo-controlled studies. A good example would be if you're really sick with community-acquired pneumonia, the evidence is very strong that antibiotics will help you survive that. They might not save you, but your odds are better if you're prescribed an appropriate antibiotic. Now, on the left side of that spectrum is stuff that we know is 100% bullshit. It either doesn't work at all, or it actually actively harms you. So, using a similar example, if you're very sick with community-acquired pneumonia, and I bleed you a couple liters of blood like they used to do back in the Middle Ages, I am not helping you, and I'm actively harming you. Okay, so that's the left side of the spectrum. So on the right side, we have things we know work. We have solid data, a very long track record of efficacy, and and then the far left is complete quackery and bullshit. So here's the thing. There's a huge area in the middle where we have a lot of therapies and interventions that might work, but we just don't know for sure. Or perhaps we know that they work in certain situations, but maybe not others, or in certain subgroups of patients, and maybe we don't quite know who those subgroups are. And that is the majority of medicine. That is the majority of medicine. The beef I have, if you want to call it that, with alternative medicine practitioners or functional medicine or naturopaths, quite honestly, they spend the bulk of their time in that middle zone and then to the left overall. I'm not saying that they don't also employ things that are evidence-based and, certainly, that we know work. But there's a lot of practitioners that fall under this umbrella of alternative medicine that, quite frankly, practice bullshit medicine. And they make a lot of money off of it. And in the long run, it's questionable whether they actually are helping people. So, when I look at my own practice, whether it's in the emergency department or whether it's in my age management practice, and by the way, age management medicine is not immune to this hokey bullshit stuff. There's a lot of practitioners that call themselves age management docs that practice to the left side of the curve. But in my case, I struggle to ensure that if I'm going to provide either advice or some sort of a medical intervention, usually a medication, that I'm as far to the right side of that curve as possible. Now, there are things that I do and that doctors I work with do all the time that are well within that middle circle in the emergency department. There are things that we know work just from clinical evidence or from clinical practice over the years, but maybe for example, there are not wonderful double-blind, randomized studies to prove it. So, I'm not saying that I'm perfect, that I only practice perfect evidence-based medicine, because no physician does that. If you only practiced medicine that was proven through multiple randomized controlled studies, then your scope of practice would be pretty small. All right, that's just the way it is. So, when I hear somebody, usually on YouTube, tell me that they're a functional medicine doctor, I don't know what that means. It's kind of a wastebasket term. And when I look it up, there's a functional medicine society somewhere, and you can get board certified in it. They say that functional medicine is different because they look at the root cause of your symptoms or the root cause of your disease, and they don't just treat the symptoms. Well, that's not functional medicine, in my opinion. That's just good medicine. I mean, I started medical school in 1996, before there was even a thing called functional medicine. And that's what they taught us to do. You always look for, if you're a good doctor, that's what you do. You look at the root cause. You don't just treat symptoms, of course, because, that's why the patient's there, is they have a symptom that's bothering them. And you treat their symptoms. But, good medicine is to also look for the underlying cause. So there's nothing special about functional medicine or these alternative medicine practitioners, etc. What is different about them, and what I think that draws patients to them, and why patients like them so much, is not that they are providing, they don't have any secrets. They don't have any special medical knowledge that the rest of us don't. The rest of us board certified MDs and DOs who've gone through their standard residency program, there's no secrets. Now, they may have different approaches to things, but what they do have, in many cases, one is they have a lot more time to spend with their patients, which is actually, it's fabulous. And so no wonder patients like them. It's, patients get a sense that when you spend time with them, the more time you sit down and talk with them and you ask them about what's their home life like, what's their social life, what are their habits, what are their interests, what are their hobbies, patients appreciate that, and it also provides valuable information as to what the underlying disease is or underlying cause of their symptoms. And so, if you go see a functional medicine provider, you are not going to be whisked in and out of that office, I would think, in most cases, in 15 or 20 minutes. Many of those appointments are probably 45 minutes to an hour, sometimes even longer, which is great. But it's not that they know anything different than I do or that, my internal medicine buddies do. It's just that they have more time. So, I was a family medicine, a regular mainstream family medicine doc for a number of years. And I had a lot of medical knowledge, at the time. I like to think I still do. But I had 15 to 20 minutes to spend with my patients. My clinic every day had 25 to 29 people in it, all lined up to see me. And by the time they were checked in and their vital signs were done and, I had time to review their labs, I generally had about 15 minutes to spend with them, which, if you're coming in for a sinus infection and an ankle sprain, no problem. I can do that in 15 minutes. But if you're coming in with your heart failure and your kidney disease and your diabetes is out of control and, I can't feel my feet anymore, and now I'm short of breath when I go up the stairs, I couldn't give good care. No doctor can fix that in 15 minutes. No doctor can do that. I would need 45 minutes to an hour to really tease that out, to come up with a plan, and then execute that plan, and then schedule follow-ups and that sort of thing. So I understand why people get frustrated with the conventional medical system when they go see their internist or their family medicine doctor. The most common complaint I hear is they never spent any time with me. They spent 10 minutes in the room. They barely talked to me. And then these days, and I've experienced this too when I went to see my primary care through the VA, is they spent most of the appointment with their back turned to me typing on a computer, which they have, they're forced to use these EMRs these days in order to keep up in their clinic. So they literally have to sit there and type while I'm talking and while they're asking me questions. And so, you're going to wonder, how closely are they listening? How closely are they thinking about what I'm saying while they're sitting there typing in a computer? You're much more likely to have, a more pleasant experience when you see an alternative medicine provider. A good example is my girlfriend occasionally sees a naturopath, and, which is fine, but she goes and sees her mainly for acupuncture. Now, this naturopath is always trying to sell her herbal nutritional supplements, which I'm like, no, don't take that. That's bullshit. But those appointments are an hour long. This provider stays in the room and talks to her and asks a lot of questions. Doesn't do a lot for her other than, provide acupuncture. But, my girlfriend loves her. She thinks she's the best doctor in the world, and I know what kind of training this individual has gone through. And when it comes to practicing medicine, I can tell you they're not the best doctor in the world. I don't even know that they deserve the title of doctor. I do know that they're a nice, caring person. And I know that they are really good at building rapport. And I have no doubt that they know what they're doing when it comes to acupuncture and those sorts of things. But I would not trust that person to take care of my pneumonia, or if I developed kidney disease, if I had, type 1 or type 2 diabetes, that would not be my first choice. So a lot of this has to do with the amount of time that these providers can spend. So my purpose is not to offend naturopaths and functional medicine doctors out there, but just to maybe simplify things for you a little bit. And I have no problem if you want to go see one of those providers, but keep in mind, there are things that work, there are things that don't work, and then there's a whole bunch of stuff in the middle that we really just don't know. And as time goes on, the whole purpose of evidence-based medicine, of which I am a proponent, is that we're going to chip away at that middle group. And we're going to start trying to put as much of it as we can into one of the two boxes and sort of figure things out. But, medicine is evolving, especially. This is going to take decades. So that's how the scientific method works. I wish it wasn't the case, but that's just how it is. So from my perspective, if you come and see me as a patient, just keep in mind, we're going to be spending most of our time, with basically, a lot of it's with the low-hanging fruit. So, I'm going to aggressively treat your cardiovascular risk factors. That's a huge one. We're going to look at your hormones. We're going to look at your nutrition and your exercise, that sort of thing. And if you have some of these more serious medical problems, I feel generally pretty confident and feel that I have the clinical experience to manage those. And you just have to keep in mind, if you go see a naturopath and maybe even a functional medicine doctor, it kind of depends on what their prior residency training in. And I would not go to somebody who is not board certified in a legitimate medical specialty if they're calling themselves a functional medical doctor. Functional medicine as a specialty, board certification in functional medicine is not a substitute for doing a traditional residency. Okay, it's an generally online program. Okay, that doesn't make you a doctor, in my opinion. So you need to finish a 4-year accredited medical school, and you have to complete a minimum of a 3-year accredited residency program, in my opinion, to call yourself a physician. Now, there may be people that disagree with me on that, but just keep in mind that if you come and see me, we're going to stay to the right. And if you don't like that, that's cool. You can go see somebody else. But I'm a believer in evidence-based medicine, and I'm a big believer in not wasting your time. And I'm a big believer in not selling you bullshit. So, pardon my French. So that's just how it is in my practice. Again, feel free to see whoever you want. But when things go south, I'm always here for you, especially in the emergency room, which I hope I don't see you there. All right, guys, that's all I have for you. Take care.
Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.